On to matters health, where the Kenya Hospices and Palliative Care Association (KEPCA) has raised concerns over significant gaps in the country's social health insurance scheme. According to KEPCA Director David Musyoki, thousands of patients with life-threatening illnesses who depend on home care remained excluded, sparking calls for immediate reforms to ensure comprehensive coverage.
At a World Hospice and Palliative Care Day event held in Embu County, the Kenya Hospices and Palliative Care Association (KEPCA) officials sounded the alarm on the limitations of the social health insurance scheme. According to KEPCA Director David Musyoki, is that currently the scheme only covers inpatient hospital services, leaving out crucial support for patients receiving care at home.
Distribute mpaka kila hospitali ipate.
This exclusion, they warn, denies many terminally ill patients access to essential palliative care, putting their health and dignity at risk, urging policymakers to expand the scope of SHA to include home-based care, ensuring no patient is left behind.
It is unfortunate kwamba katika nchi yetu ama in Kenya only less than 15% wagonjwa ambao wameathirika wanapata hizi services. These services haziko kwa wingi. SHA ina support only inpatient services kwa palliative care, lakini wagonjwa wengi ambao wanahitaji tiba shifa ama palliative care wanahitaji kuhudumiwa wakiwa nyumbani, like an outpatient service. Hiyo ni one of the biggest gaps, na tunasema pia SHA wanafaa kuconsider, kwa sababu as I contribute to SHA, SHA should also be able to support me when I need that service.
Musyoki furthered echoed on insurance gaps, frequent painkiller shortages due to Kenya Medical Supplies Authority (KEMSA) and insufficient trained staff, all worsening the suffering of patients needing essential palliative care in Kenya's hospitals.
Kuna dawa inaitwa morphine. Morphine ni dawa ambayo inasaidia makali ya uchungu. Na morphine ni one of the essential medicines ya palliative care. Na unapata kwamba mara nyingi inakuwa out of stock. Reason being ile process ya kununua na kureconstitute ama kuitengeneza kule KEMSA na kudistribute mpaka kila hospitali ipate, kuna bottlenecks, kuna unajua steps nyingi za kupata hiyo madawa. Alafu sometimes unapata ikiwa katika hospitali hata ile prescription wahudumu wengi wa afya, madaktari wetu, nurses wetu, clinical officers wetu hawana ile training ya kutosha ya kwamba hizi madawa zikuwe well prescribed na pia wagonjwa wapate access kwa wakati unaofaa.
Meanwhile, head of the Division for Health, Aging and Palliative Care at the Ministry of Health, Dr. Rosie Wafula, emphasized stigma faced by patients, had family support, and highlighted the ministry 2021-2030 plan to decentralize palliative care to grassroots communities.
Most of these persons and families are stigmatized, they are hidden, and sometimes face a lot of costs that are very prohibitive. So we pass the message that if you have a child, an adult who is facing life-threatening condition, or a family, they deserve dignity. We also want to pass the message that we have a policy in the Ministry of Health, a policy that is running from 2021 to 2030, delivering clear direction that it is not healthcare if it does not have palliative care.
A prostate cancer patient, Nelson Nyaga, urged the government to address high treatment costs and drug shortages for better care access.
Niomba tu serikali saidie iwe ina stock upande wa madawa katika pharmacy ya hospitali ya M5, sababu wakati mwingine tunaandikiwa dawa daktari kenda kwa kupata kwa dirisha pale haiko.
The urgent call from KEPCA and patients alike demands swift government action to expand insurance coverage, improve drug availability, and enhance training, ensuring dignified, accessible palliative care for all Kenyans. Edna Nerea, KUTV, Nairobi.